Check the description below for free resources that you might find helpful.
You are assisting a resident with their meal when they appear to be choking severely. Suddenly, they stop breathing and can't make any sounds. What is your immediate response? A. Check their mouth for the object with your fingers. B. Call 911 and wait for emergency services. C. Begin abdominal thrusts right away. Or D. Yell for help and start CPR. The answer is C. In a severe choking emergency, for instance, the person cannot breathe or make noise, abdominal thrusts are the immediate life-saving intervention. A resident with epilepsy begins having a grand mal seizure in the hallway. They are shaking violently on the floor. What is the single most important action to take during the seizure? A. Gently hold their head to the side to keep their airway open. B. Call the nurse and protect their head from hitting the hard floor. C. Hold them down firmly to stop the shaking. Or D. Put a rolled-up washcloth in their mouth to stop them from biting their tongue. The answer is B. The priority during a seizure is safety and preventing injury. Gently protecting the head and clearing the area is correct. Never force items into their mouth or restrain them. An adult family home resident complains of sudden, crushing chest pain that radiates down their left arm and jaw. They are pale, sweaty, and short of breath. What potential emergency is this, and what should you do? A. A stroke, help them lie down comfortably. B. A fall risk, assist them to a chair immediately. C. A heart attack, call for emergency medical help immediately. Or D. Hypoglycemia, get them orange juice immediately. The answer is C. Crushing chest pain radiating to the arm and jaw are classic heart attack symptoms. Emergency help must be summoned immediately. You find a resident on the floor next to their bed. They are confused and responsive to your voice, but unable to stand up and report pain in their hip. How should the CNA manage the resident immediately after finding them? A. Call for help, keep them still, and don't attempt to move or lift them. B. Quickly help them into bed to prevent further injury. C. Check their blood pressure and offer them pain medication. Or D. Leave to find a nurse to assess the situation. The answer is A. A potential hip fracture means that moving the patient could cause permanent damage. Keep them still, call for help, and wait for the nurse or other trained licensed staff to assess and move them safely. A resident with diabetes who is usually alert now seems very agitated, restless, and weak. Their skin is clammy and sweaty. What is the likely cause, and what is your immediate action? A. Hyperglycemia or high blood sugar. Encourage fluids. B. Hypoglycemia or low blood sugar. Offer them a quick sugar source. C. A stroke. Perform the FAST test by checking the face, arms, speech, and time. Or D. Dehydration. Give them a full glass of water. The answer is B. Agitation, sweating, and weakness in a diabetic resident are indicators of low blood sugar or hypoglycemia, which requires immediate administration of sugar or quick carbs such as orange juice or glucose tablets. Mr. J is eating gelatin and starts coughing forcefully. He is red in the face, but is moving air and making noise. What is the CNA's correct action in this mild choking scenario? A. Immediately perform abdominal thrusts. B. Call 911 and prepare for CPR. C. Encourage him to keep coughing forcefully to clear his airway. Or D. Use your fingers to sweep the food out of his mouth. The answer is C. If a person is coughing forcefully with mild obstruction, their body is effectively trying to clear the object. Encourage them to continue coughing. Do not perform abdominal thrusts unless their coughing stops and they are in distress. Call for the nurse either way. The CNA finds a resident who typically walks independently, collapsed in the bathroom. They are unconscious and do not have a pulse. What should the CNA immediately do? A. Elevate their legs and cover them with a blanket. B. Start CPR and call the nurse. C. Check their blood sugar immediately using a glucometer. Or D. Turn them onto their side and wait for the nurse. The answer is B. The absence of a pulse and consciousness requires immediate initiation of the chain of survival, which means calling for help and the nurse, and starting CPR. The CNA observes a resident having a seizure. Once the shaking stops, the resident is unconscious but breathing normally. What is the correct action immediately following the seizure or post-ictal phase? A. Prop them up to a sitting position. B. Place them in the recovery position, lying on either side. C. Give them a snack and juice right away. Or D. Help them walk back to their room. The answer is B. After a seizure, placing a person in the recovery position lying on their side, preferably the left side, helps maintain an open airway and prevents aspiration if they vomit while unconscious. A resident with a history of heart failure suddenly becomes severely short of breath, gasping for air, and is cyanotic around the lips. What action should the CNA prioritize? A. Help them lie flat on their back to rest. B. Give them a glass of warm milk to relax. C. Raise the head of the bed to facilitate breathing and call the nurse. Or D. Take their temperature and report later. The answer is C. Severe shortness of breath, especially with pale, bluish, dusky, or cyanotic skin and lips, is an acute respiratory distress emergency. Elevating the head makes breathing physically easier and is a favorable immediate intervention. A resident receiving oxygen via nasal cannula suddenly pulls it off and rips the tubing. They are experiencing shortness of breath. What is the CNA's appropriate first action? A. Readjust the gauge to maximum oxygen level. B. Reapply the nasal cannula and check the gauge for oxygen supply. C. Tell the resident they are not allowed to remove their oxygen. Or D. Report to the nurse. The answer is D. The priority is patient breathing. The nurse must be notified immediately since the tubing is ripped, thus no longer functional. The CNA is not allowed to adjust the gauge on the oxygen tank as it is outside of their scope of practice.
Miss Nicole's CNA Test Prep Activity Book, Volume 1, is now available in digital format. Volume 2 is coming soon. Visit MissNicoleCNAStudyGuides.com.